All right, good morning, everyone. Welcome. Today is, I think, the 7th convening of the New Jersey Paid Leave Outreach Collaborative. Our topic today is access to earn sick leave in New Jersey, and we're really happy to have you all here. Just very quickly, some basic, as we always do in Zoom, just to remind you, we're doing it in meeting format, so we can hear you, but until it's time to have a discussion, just please make sure you're unmuted and you can switch to speaker view. And we are recording, so the recording will be sent to folks after today's event. And I'm going to do introductions. So my name is Yarl Wilman-Cole. I use pronouns she and her. I am the Workplace Justice Program Director at New Jersey Citizen Action. And for some background, while everyone is joining, I should say, please introduce yourself in the chat with your name and your pronouns and your organization as we're getting started. But for some background on the Paid Leave Outreach Collaborative, I'm going to launch a poll as well, just to get a sense of who's here. Give me 1 second. Oh, no. I don't know, Nat, if you can try to do it, but it might be because we have many co-hosts, so I don't know. Sometimes
I just launched it.
You can see it? Everyone can see it? Yeah. Great. Okay, so again, I'm with New Jersey Citizen Action, and we convene the New Jersey Time to Care Coalition, which works in collaboration with many different organizations to do advocacy to promote policies that help working families care for their health and their loved ones. And that's the background. We launched the Paid Leave Outreach Collaborative to widen the audience of people who would be interested and involved and care about outreach and education. So we separated out the advocacy work from the education work. And so we're building the Paid Leave Outreach Collaborative, and we welcome your ideas and thoughts as we're trying to grow efforts to address issues around lack of awareness, lack of access, that workers have in terms of paid leave, both paid family and medical leave, as well as paid sick days, which is what we're going to be talking about today. So if folks can continue to introduce themselves in the chat and also answer the poll. This is just a brief description of the New Jersey Paid Leave Outreach Collaborative. Again, I think I mentioned the purpose, so all are welcome to join. We are building out our different committees and work groups, and we welcome you to participate in all those as you're able to join and provide input. And here's the form to formally join the Paid Leave Outreach Collaborative. And with that, I'm actually going to turn it over to Nat, who is going to introduce themselves and facilitate our event today. Nat, welcome.
Hey everyone, my name's Nat Mogay. My pronouns are they, them, and I am a paid leave organizer. Yeah, so I just wanted to share the purpose of our website that we developed actually a few months ago. So you could go to our website and press join the collaborative, which is at the top, and I'll share the link in the chat. But you could press join the collaborative and it'll bring you directly to this form that you see on the slides. And on the website, you could also, there's an events page where you could find our calendar, which will have our quarterly convenings, our steering committee meetings, as well as our work group meetings. And we have an entire tab on our website that's dedicated to our work groups, which we created to basically help target outreach and education more precisely to different audiences. So yeah, that with that, we still are waiting for people to participate in the poll. We have most of our results, but I will drop the link to the website for all of you.
I did it for you as you're
cool.
talking.
Awesome. But yeah, as I'm waiting for the results for the poll, I guess that I could introduce Calandria, who is with the New Jersey Coalition to End Domestic Violence, and is also a member of the collaborative. And Calandria will be giving us an overview of the difference between paid sick days and paid family leave, and the issue of access to short time of paid leave and earned sick days.
Thank you, Nat, and thank you everyone for being here. Like Nat mentioned, my name is Calandria Ortiz Resende. I am the policy coordinator at the New Jersey Coalition to End Domestic Violence, and we are really happy to be involved in the collaborative and Time to Care, because thanks to their advocacy, also issues to deal with domestic violence and sexual violence are covered under the laws that we currently have. Give me 1 second, let me close this pool here. To begin with this presentation, I want to clarify or to clarify some terminology, and that is the difference between pay leave and earn pay sick and pay leave and pay sick days. The difference is notable, even for me, who have been working with JARO. So much is confusing sometimes. So, but the idea is like pay and save days, and we are using save days as a matter of fact, because that covers days for, like I mentioned before, for people who are dealing with domestic violence and sexual abuse issues. So this is why it's safe days too. So pay sick and safe days refers to the routine illness that usually doesn't require many days for recovering. That is like a cold, a flu, and some other issues that can happen unplanned. And earned sick leave are earned sick leave payments are provided by the employer. Those days that are less than 3 days, they don't require documentation, and they are also, the payment for those days are provided by the employer. On the other hand, we have the pay family medical leave. That's the one that take longer, sometimes maybe some planification to inform and some documentation to inform the employers. Those are in New Jersey, the family leave and temporary disability insurance program provide this coverage. And that refers to the, like I mentioned before, to the coverage for longer absence for serious illness, and for instance, to take care of a child, like we know, like paternity leave, or also to take care of a kid that a child that we may adopt, an aging or disabled loved one. And this pay and medical leave is managed and paid by the state. That's the difference in payment. The paid sick leave is paid by the employer, and paid family and medical leaves are managed and paid by the state. Both of them do provide a partial payment, and we will discuss that later. Let me see here. Okay, and today we are going to focus on earned sick and safe leave specifically, that help to protect public health because of the transmission of germs and viruses, support the worker ability to recover for illness, manage the obligation, including coping with dealing with issues related to domestic violence. In the federal state, in the whole United States, in the whole country, it has been an issue because there is no a federal global pay leave for all states. But luckily, we here in New Jersey, we have it after a lot of work in advocacy, being the Time to Care the lead agency on that. What we have to know also is that even though the law passed and we have the law, now there is a 40% use only. Let me check here. 40% 40% of the employees are not using it, even if the laws stand, and this affect most lower wage employees. These affect more people who work in the service industry, people who work in the hourly contract, and this is what is the main goal for this collaborative, to expand the knowledge of the law and expand the access for everyone to know that this is a lot. The workers, the employees have to comply with this law, and we as employees have the right to oh my God, I'm losing my words. We have the right to ask for this when we need it, to take care for us, for our families, and so on. We are now going to show a video of a real situation that can happen to any one of us, and it's going to give you a context of how earned pay leave can work, or should work. And also, I'm going to, during this video, I will be hosting a small workshop, breakout room in Spanish for those who wants to discuss what I just discussed in Spanish. I'm going to say this now in Spanish. Hola a todo el mundo. Lo que yo acabo de cubrir ahora en inglés lo voy a discutir en un grupo del Zoom individual en español. Si quieren reunirse con nosotros, pueden acceder al cuadrito que le va a salir ahora, y ahí vamos a discutir y a resumir lo que yo acabo de decir en español. Now I'm going to take this back to Nat. Thank you.
Thank you so much for that, Calandria. As Calandria just said, we're going to watch a short video about paid sick days. Before I do that, I want to share our poll results really quickly. So for our first poll, can you guys see those results on your screen? Yeah. So yeah, it seems like, yeah, we have mostly advocate and organizers, but we have people from every group basically, except funders. But yeah, it's great to meet all of you. And I'm excited to bring all of those perspectives into the conversation today. And as for our second question, yeah, kind of a even match between all of them. Yeah, I'm excited to, talk to you guys more about earned sick and safe days. So yeah, I will start sharing my screen, and we'll be hearing about Monica's story, who's a mother who needed to care for her son while he was ill. Sorry, give me 1 second. Okay. Okay.
So we put him in his bed. I came downstairs to clean up the kitchen. Next thing you know, he's like, no. And I'm walking up the stairs, and he's like, call 911. And when I got halfway up the stairs, he's holding him, and he hands him to me. And I can feel him like shaking in my arms. That's you? That's your number right there? And next thing you know, I ended up in a room, and it was like all these doctors around him. And they said that he had a seizure because his fever spiked up so high. So what is the first initial sound that you hear? A. We were there till like 6 in the morning, and I had to be to work at 7. I came home, got dressed, and went to work. And then when I told my meat wrapper, I'm like, oh, you know, my youngest son had a seizure last night, and I'm tired, and I've been in the hospital all night. She's like, what the hell are you doing here? Why are you here? Families first, families first. And I'm like, yeah, why am I here right now?
My wife has been real sick in the bed, and I'm just doctoring her, and I'm telling her to call in, make sure, you know, you don't go to work. And I just think that she felt threatened by it and just went to work anyway, like she would lose her job if she didn't show up or something.
Obviously, going to public schools, they get sick quite often. And I remember Kennedy being sick.
Now we lay me down to sleep. Praise the Lord.
And now that basic day, I can actually stay at home with my son and not worry about my check being short, not worrying about a bill not being paid. You know, I really do think family is first.
Monica isn't the only one that can earn paid sick days because of family values at work and their partners. That number is more than 10 million people. Millions more can use their time to take care of a sick child or take dad to the doctor. Others are no longer disciplined for taking a sick day. People don't catch germs from someone forced to work sick. Local businesses have healthy, committed workers and more customers. We all win with paid sick days.
All right, great. So now we want to welcome a representative from the New Jersey Department of Labor, Rebecca Glenn, to provide us training on New Jersey earned sick and safe days. Welcome, and would you be able to hopefully share your screen for your slideshow?
Hi, everyone. It does say my screen sharing is disabled, so if you could make me a co-host maybe, and I'll be able to do that. I actually won't be doing most of the presentation. I brought my colleague and expert at Earned Sick Leave, Kim Webster. So I'm going to pass it to her, but I'll share I'll be sharing my screen for her. So
awesome. And I believe Yaro just made you co-host. So.
Okay. There we go. Kim, why don't you take it away?
I don't think that we could hear you, Kim.
Can you hear me now?
Yeah.
Yes. Is that better?
That's perfect.
Okay.
Thank you.
All right. I'm sorry. It's all these different wires we have here, and we're connected. Again, my name is Kim Webster, and I'm a field representative with the New Jersey Department of Labor Wage and Hour Division. And I am so happy to be here to present to you the laws of earned sick leave. And I heard Ms. Ortiz talk about a little bit of it earlier. So we're going to go next to the disclaimer. So before we begin, there is a small disclaimer, and I really want to talk about that this presentation is for general information only and does not carry the force of legal opinion. Next, Rebecca. Let's talk about the earned sick leave and how it is a law in New Jersey. And when did it begin? October 2018. Most employees are eligible for the New Jersey earned sick leave. Employers are required, regardless of their size, to provide earned sick leave for all employees. May they be full-time, part-time, or temporary. So what are temporary employees? They are migrant workers or seasonal workers, okay? But again, they're required to provide you up to 40 hours, which is 5 days over a course of a benefit year. Rebecca? Who's covered? Well, I just mentioned full-time, part-time, and temporary, but I also want to talk about regardless of your pay, you're entitled to earn sick leave. And the employer, again, by law, must grant you with this earned sick leave, but there are some limitations. And when we talk about the limitations, we're talking about those that are limited in regards to exemption. So who's exempt from earned sick leave? Let me be a little clearer. They would be construction workers under a bargaining agreement. They would be some of per diem workers. They would be independent contractors, and they can also be public employees who actually have full coverage under earned sick leave by the state. Next, Rebecca. When can I use earned sick leave is really the question. As it was stated in that presentation, that beautiful video, if you're sick, that's real important to use earned sick leave, right? Say for instance, not only if you're sick, maybe you have to get a COVID vaccine, or you're recovering from side effects. Maybe you're attending a meeting at your child's school. All of these are times in which you can actually use earned sick leave under the law in New Jersey. Next, Rebecca. How do I accrue earned sick leave, you may ask? Employees accrue 1 hour for every 30 hours worked. That's real important, and I want to repeat it again. 1 hour for every 30 hours worked. You earn up to 40 hours of earned sick leave throughout a benefit year. You can carry over up to 40 hours of earned sick leave as well, or your employer can choose to pay you out for those hours that were not used, okay? Now, earlier it was mentioned about having documentation if you're out sick for 3 consecutive days. So the law states that if you're out for 3 consecutive days, it is at that time that you must provide documentation to your employer. But if you're taking an hour here or a day there to take care of a loved one or take someone to the doctor, or you're not feeling well, just that particular day, you do not have to give a reason as to why you're calling out sick, but you do need to let the employer know that you're actually going to use sick time. But as every employer would like to know in advance, if you know anything in advance regarding maybe you have some surgery or procedure, please let your employer know. They would be gracious to be able to plan their workload. Next, Rebecca. How are sick days paid out? Sick days are paid out at the same normal rate of pay that you would get in regards to your hourly rate. So if you get $13 an hour and you call out sick, your sick rate would be 13. But if you get $40 an hour, like some people could, you would get $40. But different calculations do exist for the following types of employees: tip workers, multiple rate of pay. Those are people that may work for an employer in different types of capacities and their rate may change. Piecework or commission. What I do want to say about these workers is that all of these workers are required to get at least the minimum wage of $13 an hour in 2022. However, if they make more than that on their hourly rate, they would of course get more than that if they called out sick. The employer is required to pay you in the same or next pay period, and the pay must come with your regular paycheck or another method that can be deposited or cashed easily. Rebecca? Protection from retaliation. Employers by law are not permitted to retaliate against anyone that chooses to file a complaint with the state of New Jersey. You have rights, and to learn your rights, you can go to myworkrights.nj.gov and learn more about it. But I do want to read the last portion here that's very important. New Jersey Department of Labor employees do not ask questions about immigration or citizenship and serve all workers regardless of their status. New Jersey Department of Labor will not share any information from an investigation with any federal immigration agency unless legally required to do so. With that being said, that concludes my portion of earned sick leave. I'm now going to turn it over to Rebecca, who's going to talk about New Jersey paid family leave and medical leave, the differences. Rebecca?
Thanks, Kim, for passing the baton. So like Kim said, and was alluded to earlier in this meeting, there is another paid leave law that might apply to you. And we call that paid family and medical leave, okay? And we just want to make sure that you guys can sort of understand the differences so you know which law you might utilize in a given situation. So this is a very brief overview of what I mean when I say New Jersey paid family and medical leave. You might know it as temporary disability and family leave insurance. These are cash benefits that you can get from the state if you need extended time off of work, so weeks at a time. And this is cash benefits to care for yourself or a loved one with a physical or mental health condition, to care for yourself during pregnancy and childbirth recovery, to bond with a new child, whether it be a newborn, a foster child, or an adoptive child, or to cope with domestic or sexual violence. So you can see in this list, there's a lot of overlap between what you can use paid family and medical leave benefits for and what you can use earned sick days for, which your employer pays. Under paid family and medical leave, you receive a partial wage replacement. So you can get up to 85% of your average weekly wage. This changes, the maximum changes every year. So you can go on our website to learn more. There's some additional eligibility requirements. Eligibility for paid family and medical leave is different than earned sick leave. So that's important to understand. I won't go into the details right now, but feel free to follow up with me or check out our website for more information. There are some key differences, okay? So the first is how you're paid. For earned sick leave, your employer is paying you. They're paying you in your normal paycheck. It's a right that you should just get, right? Just like minimum wage. You don't have to apply for minimum wage. You should just be getting minimum wage. In the same way, you should just be getting earned sick leave from your employer. Temporary disability, or getting the opportunity to accrue sick leave, to earn it. For temporary disability and family leave insurance, this is a benefit that the state pays you, and that you have to apply through the state to receive. The benefit amount is different. For earned sick leave, you're getting your normal rate of pay. For paid family and medical leave, you get 85% of your average weekly wage. In 2022, that number is $993 per week. The maximum is $993 per week, but that'll go up in 2023. The documentation requirements are also different. So the employer can require documentation for earned sick leave only if leave is taken 3 or more days in a row. For paid family and medical, for temporary disability and family leave insurance, or paid family and medical leave, you're going to have to apply. The state is going to request some information from you, as well as medical provider certification, depending on the need for leave. And something that's not on here that I should have put on here is that, like Kim said, we enforce earned sick leave regardless of immigration status. You do not need a valid social security number to exercise your right to earn sick leave. For paid family and medical leave, however, the application process does require a valid social security number to apply. This is just a contact us slide. So as Kim said, we enforce your right to earn sick leave. If you feel like your right to earn sick leave is being violated, or you're being retaliated against for seeking to take sick leave, you can file a complaint. Our information is here. The slides will go out after this presentation, so no need to write it down just yet. And My Work Rights, which Kim mentioned, is really a directory to all the different work rights you have in New Jersey. And then there's also special information depending on the type of worker you are. So we have special information for farm workers, tipped workers, domestic workers, information for victims of domestic and sexual violence, etc. So that's a good website to know as well. So I believe we have about 5 minutes to take questions. Kim is here to answer your questions about earned sick leave. We also have David Bander in the audience, who's our policy director, who can help answer some questions as well. And we also have Sanjana Chandrasekharan, who's also with the Department of Labor. So we have a bunch of people here ready to answer your questions. So feel free to unmute yourself or put them in the chat.
Rebecca, I have one question in the chat that says, can you repeat which requires a social security number? Is it TDI?
Yep, temporary disability and family leave insurance, which are the 2 insurance programs that make up paid family and medical leave. require a valid social security number on the application. So you do need one. But for earned sick leave, like Kim said, we enforce regardless of if you have a social security number.
This is Calandria. Thank you, Rebecca. A question was raised in the Spanish group. People who doesn't have a social security number but have the ITIN number, can they apply, or it has to be a social security number for the family?
Right now, you need a valid social security number.
And
yeah,
if they are seeing that their employers are taking funds away from their check, can we assume that this is for something other payment and not for the TDI?
I'm not sure what might be on their pay stub, but if you have a specific question about what is on their pay stub, feel free to email me. I'll put my email in the chat and we can work on that together.
Thank you. And one last question that was raised, temporary workers, can they apply for TDI if they have a valid social security number?
So for temporary disability insurance, it's an earnings requirement. So as long as they've earned the amount of money you need to earn, then they could apply. Yep. There's some for job protection. There's some other eligibility job protection is separate from cash benefits. There's some other eligibility requirements that they might not meet. You have to have worked for an employer for a certain amount of time, but we can talk about that maybe offline if there's a specific situation.
Thank you.
Here's a question in the chat, just confirming that if you have worked a job, whoops, excuse me, I'm sorry, it just moved. We have a couple, so let me go back. Just confirming that if you have worked a job for the last 3 years and never took sick days, that you would be eligible for payout of your sick leave if you leave for a new job. The answer is to that, no. Is that correct, Dave Bander?
Yeah, that's correct. It's the employer's choice. In my experience, very few employers have, it's a choice between letting the employee carry over time or paying out. And in my experience, very few employers have preferred letting employees collect their sick leave when they leave. The employers generally just roll it over.
Correct. Thank you. Next question that we have. The same goes for Social Security. If on payroll, all contributed toward it, even if they can't access it. Billions contributed that are inaccessible around the US.
I think I know what you're saying. You're saying that some people are contributing into these funds, but then are temporary disability and family leave insurance, but then can't access those benefits. And you're absolutely right. You're absolutely right. That is, something we're thinking about.
The same thing is true with unemployment, Lou, as I'm sure you know, that you have to have a social security number to be eligible for unemployment.
Yeah.
But again, you don't have to have a social security number, right, to be able to earn sick leave, to take a day here or some time here. So just keep that in mind. Thank you.
Sorry to keep asking.
No, please do.
When people are paid cash, can they still ask for the earned sick leave? Like the law is also, even if they are paying cash and there is no, like, from the employer, like they cannot deny that just because they're paying cash, right?
Well, I'm going to turn that over to Dave Banner, but I do believe in Dave. I would love for you to tell me if I'm right or wrong on this, but this is very important, is that the employer has the choice of how they choose to pay their employee. They just have to keep record of it. Right. So Dave, I'm going to let you further answer that.
Yeah. That's more of a, like, how they choose to pay their employees. It doesn't change their obligation under the earned sick leave law. There's still that requirement to provide earned sick leave, regardless of if they pay them in a biweekly paycheck or if they're just paying them in cash.
Correct. They
All right,
still
so-
should be a part of payroll. They should have documentation. And they should keep their records for 5 years. They should be showing from day one, let me just state this, from day one, an employee begins to earn sick leave the day they start, and then they're able to use it after 120 days on the job. So that wasn't in the slide, but I do want to share that with you. So they begin to accrue it starting day one.
And if an employer is paying an employee off the books, to like avoid their obligations under the law, that is on the employer. An employee, like, is this correct, Kim? An employee will not get in trouble for that. That is on the employer. So if that's like a situation where an employee is being misclassified or they're being paid off the books,
that's something we would like to know about to investigate.
that is something we investigate, and is not to the penalty of the employee, even if the employee initially went along with it, right? It is up to the employer.
Gloria? Oh, I'm sorry.
Hi, yeah, good morning. I have a question. In case the responsibility for keep the records about the persons who pay, who get cash, who is the I know sometimes they are both are responsibility for keep that records, right? But this more responsibility for the employer or the worker?
The employer has to keep record.
Okay. My second question is, the basic leaves is 5 days for year?
Yes, 40 hours equals 5 days over a benefit year.
According to what you are telling this presentation, yeah, you talk about 3 days. 3 days is for no presentation. You can take it if you don't have any proofs or the absent. It's right to take it at 3 days.
Can you repeat that? I didn't quite understand.
You're asking about what is the 3 days, the 3 days requirement. Can you distinguish how that's different, Kim? Like the 3-day requirement, it's
So
you only need to, yeah.
So the 3-day requirement is if, let's say, for instance, you have COVID, right? And you're out for 3 days, more than 3 days, your 4th day out. To come back to work, you're going to need to bring documentation to your employer.
All right.
However, keep in mind your maximum amount of earned sick leave is 5 days or 40 hours.
For year.
Per calendar year, benefit year, yes.
At minimum, your employer has to be that generous at minimum. Some employers are more generous, but your employer has to provide you at least that amount, or allow you to accrue at least that amount.
In these cases, it doesn't matter if the worker works part-time or full-time.
That is correct. Okay. Everyone's entitled to earn sick leave. That is correct.
Thank you so much.
You're welcome.
And just for clarification, Kimberly, less than 3 days, they don't need the documentation to get back into work.
That is correct. That is correct. The employer cannot require you to even tell why you're out sick. Let's say I need a mental health day. I'm just drained. I can call out sick and just let them know I'm going to take a sick day.
So I'm going to have to do a time check because it is 10:40. But everyone else who has questions, feel free to put your questions in the chat, and we'll send responses to the questions in our follow-up email, and also make sure to forward it to those folks at the Department of Labor. But thank you so much again to all of you at the Department of Labor for taking the time to be here today. We really appreciate it. And we want to now open up our discussion, a panel discussion on access to New Jersey earned sick days, which will be facilitated by Rosanna Rodriguez, who is the co-director of the Laundry Worker Center. Welcome, Rosanna.
Hi, everybody. Good morning, everybody. Nice discussion. Thank you so much. So now we're going to pass to a panel discussion section where we're going to speak with some friends and allies about the access of earned sick days. First of all, I want to introduce myself. My name is Rosanna Rodriguez. I'm the co-executive director of the Laundry Worker Center. The Laundry Worker Center, we are a non-for-profit that advocate for low-wage and immigrant workers here in New Jersey, but also in New York City. We work mostly with marginalized communities that have many barriers to access to workers' rights, and specifically, as many of you discussed, to family leave, because the requirement of the Social Security or the valid Social Security that the Department of Labor already mentioned. I just want to give a little background of last year and during the pandemic, Laundry Workers Center launched a report on commercial laundromat industry. The purpose of the report was to identify the working condition of the workers. And part of the research was like, the access to earned family leave, to access to sick days, sorry. And what we found out is like 49% of the workers, and we survey more than 350 workers in the state. We visit more than 120 cities, and we visit most of the counties in the state. So 49% of the survey workers, they report that they were unaware about their rights to access to paid sick days. Super high number, very shocking. And what we found out is just 2% of the workers, they say that they have access and the employer allowed them to take the paid sick days and they get paid for that. And the rest of the workers, they say like they are aware about the law that this benefit exists, but they have fear to really speak up and ask the employer about this because, they fear retaliation, they fear to lose their job. So, I just want to say like Laundry Workers Center and other allies here and partners are very proud to be part of the collaborative with the New Jersey Department of Labor now, this grant that are gonna give us resources to really go to the ground and continue doing education and outreach to workers. It's really key that we continue creating awareness about the importance of basic days and the other benefits that exist in the states. But still, we know that it's not enough, and enforcement is really key to really succeed and go to many other workers. So with that being said, I want to introduce our panelists. I want to introduce Daniel, give me 1 second. Daniel Galvin. He's a professor associate. Give me 1 second. He's a professor associate. Yeah. And Daniel is gonna speak about, focusing on if you can share what your work is focusing on and what are the findings that you get into this research with the Workplace Justice Lab at Rogers, and how you see this research showing that, how is the access to earned sick leave in New Jersey from this research that you did last year.
Okay, thanks, Rosanna. Hi, everybody. It's really great to be with you all. I'm going to share my screen here if I can. I am a professor at Northwestern University, and I do a lot of work with the good folks at the Workplace Justice Lab at Rutgers. So in the fall of 2020, the New Jersey Department of Labor asked me to examine the data on workers' access to paid sick leave in New Jersey. And specifically, they were interested in whether workers' access grew after the law became effective, and whether there was change over time, in particular once COVID hit, and how New Jersey compared to states that didn't have a similar law. So this was a research report, a policy report. I used the CPS data, which is widely considered to be the best on hours and earnings. It asks respondents whether they were absent in the previous week for reasons including those covered by the law, and whether they were paid for those absences. So the law was enacted in October 2018, and employees first became eligible to use their accrued leave on February 26, 2019. So because of COVID, I focused on 2 time periods: the first year of the law's operation, which would have been from March 19 to February 2020, right before COVID, and then March 2020 until October 2020, which is when I wrote the report. In addition to looking at change over time in New Jersey, I compared New Jersey to the neighboring states of Delaware and Pennsylvania, which served as kind of a control group. Those states had extremely similar rates of absence in paid absences in the years prior to the enactment of the New Jersey law. Obviously, they're right next door, and they have roughly similar economic and demographic makeups. But neither Delaware nor Pennsylvania had its own earned sick leave law on the books during this period. So whereas all workers in all 3 states could take advantage of the federal Families First Coronavirus Response Act, which gave everyone access to some paid time off in the early months of COVID, only workers in New Jersey could also take advantage of New Jersey's state level law. So I'll give you the basic highlights of what we find in the report here, is that in the first period, the likelihood that any given employee in New Jersey would be paid while absent from work for a reason covered by the law actually declined, while absences in Pennsylvania and Delaware remained about the same. But beginning in March 2020, things changed. During the COVID pandemic, absences in all 3 states grew at roughly equal rates, and paid absences increased as well. But the likelihood of being paid for your absence in New Jersey increased by almost twice the rate as the increase in Pennsylvania and Delaware. But that's a pretty high level of aggregation. And since a fair number of salaried workers get paid time off from their employer, from an employer plan, I thought it'd be more useful to look at changes among hourly and part-time workers who might need the state law more. And so here the change was even more dramatic. Hourly workers in New Jersey experienced a drop in paid absences during the first year of the law's operation, whereas in the control group of Pennsylvania and Delaware, there was no change. But then during the pandemic, hourly workers in New Jersey clearly took advantage of the new law. Their likelihood of being paid for covered absences grew at a rate that was about 4 times the % increase in Pennsylvania and Delaware. Similar trend for part-time workers. It was even more striking, actually. These workers also saw a significant drop in the first year, while our control group basically showed no change. But then during the pandemic, the likelihood that part-time workers in New Jersey would be paid for covered absences grew at a rate that was about 3 times the increase. I also tested the differences in a more complex statistical model, which I'll spare you, but all these differences held up. In terms of demographics, I found that during the early period of COVID, men in New Jersey were significantly more likely than women to be paid while absent. US citizens were significantly more likely than non-citizens, and middle-aged workers were significantly more likely than very young and very old workers. The other groups had small sample sizes, and so it was hard to distinguish. In terms of the industries, absences went up in every industry during COVID, but significant increases were noted in wholesale and retail trade, transportation and utilities, and leisure and hospitality. But of those, only wholesale and retail trade saw increases in paid absences. There was no increase in leisure and hospitality and other low-wage industries. To sort of sum up, unfortunately, the data don't tell us why absences went down during that first year, or why workers were better able to take advantage of it in the second period. One might speculate that in the first year, workers were accruing their earned sick time. They were saving it up, 1 hour for every 30 hours worked. and then spending it during the COVID period. But I can't say given this data. But either way, the good news is that during COVID, the law seemed to work fairly well relative to neighboring states. But we're only talking about less than 1% of all workers in New Jersey who took advantage of it during the early years of COVID, which is in line with what Rosanna said about only 2% taking advantage of it more recently. So clearly a lot of work remains to be done to get the word out about the law, to help workers access the law and to make sure that it is enforced. So I'll stop there and pass it along to some great people from some great organizations who are doing this important advocacy work. Thanks.
Thank you so much, Dan. And it's clear that, during the pandemic, the need of earned sick days, the paid sick days, and other benefits are really key and important for people. And like that part of, like how the demographic part, how certain groups have access and other are not, is very critical for us in Open Eyes. So now I want to pass to Lou. He's the executive director, Lou Kimmel. Sorry, Lou. Lou Kimmel, he's the executive director of the New Labor, and it's an organization that educate, organize, and fight for better conditions and social justice in the workplaces. And also Lou is here in representation of the Protect New Jersey Workers Coalition. And if you can share, Lou, what we discovered of surveying workers this past summer. Welcome.
Hey everyone, how's it going? Thanks, Rosanna. So I'm Lou from New Labor. And just to back up, it's kind of looking here first, the second question was put in the poll, right? So that 75% of us don't know or kind of not fully aware of what earned sick time is, right? So, we're almost 5 years in, or 4.5 years in, and we see there's a lot that we're up against, right? So it's not just, workers on the ground, but us as organizations and advocates, right? And then also, what Daniel's just showing, we have similar statistics. We did some surveys with temp workers over the course of the pandemic, and about 90% also we're not getting sick leave or FFCRA, which is kind of, to put it mildly, it was kind of like a shit show. Most people did not have access to that, right? So, it's kind of telling if 99% were not getting paid sick time during the time of COVID, that we're seeing, similar things as Rosanna's mentioning with the Protect NJ workers. So I think it's kind of important, like where do you get the data from, as Daniel's mentioning. So for us at New Labor Laundry Worker Center, right, we're the eyes and ears on the ground, as we have workers there that have been trained to do training, follow up with workers, build confidence with them to get them to share candidly what their realities are, right? So with Protect NJ Workers Coalition, we, Laundry Worker Center, Citizen Action, and other 12 groups, we came together right during the time of the pandemic to try and do something because nothing was happening due to OSHA not doing anything at that moment. So we fought to win an executive order in New Jersey for basic pandemic worker protections and provide trainings, right? And since then, we're still fighting to make sure there's safe workplaces for all, right? So, what we find is that an employer, if they're not complying here, they're usually not complying with other areas too. So we want to get like a whole picture, and then thinking about when it comes to compliance and follow up, how do we have interagency cooperation, right? Or how do we have interorganizational cooperation around that? So I can kind of share some stuff. I didn't get links because that's unfortunately the way it ends up working. But we did some surveys over the summer, about 360 workers around the state with different industries, right? So I think you all can see that this is the popular report we all put together based on those surveys. And you can see at the bottom, right, kind of aligning with what Rosanna found with Laundry Worker Center, 49% not getting sick time. Here was 52%, right? So we're seeing basically half the workers, right, are not able to access their right? As you can see here, it's also not clear beyond that, right? Where do people go, right, if they're not having their voice heard, right? Or who do they follow up with when it comes to having safe conditions at work, right? So, and the fear of retaliation is real. So knowledge isn't necessarily power. It's the first step in getting power. But, if people are afraid, right, to exercise that right due to fear of retaliation, then it becomes a little bit harder to enforce that. So at the same time here, this is a fuller report. We had a colleague, Michelle Ashner of Rutgers. I'll put that together based on the results And again, you could see kind of aligning in this section here, it says employer health and safety practices, that 80% also did not receive paid leave during COVID, right? So it's not just around earned sick time, right? There's other factors at play here too. And I'm sure Rosanna can mention that, again, if there's an issue with earned sick time, there's also other issues with wage theft. In fact, if this isn't paid, it's considered to be an act of wage theft. So you have to file a formal complaint with the DOL to get that process rolling, to make sure that earned sick time is paid, right? Otherwise, it's considered to be a wage theft, and it goes through that whole process there, right? So this is kind of what we're up against. So hopefully that kind of captured in a nutshell what we've been seeing on the ground with our own survey I mentioned previously around temp workers in 2021. It's similar. We actually had 64%, and this is out of 129 respondents that were not getting earned sick time. So you're hearing 49%, 52%, 64%. So we're kind of lining up around half the workers not being able to access this, right? So that's where it comes in. Rosanna mentioned enforcement. The first part is around outreach. So our organizations are doing that, right? Getting the basics out, what is it? But then also strategizing, how do we make sure it gets paid in the end, right? If it's through a formal complaint or other forms of action to get that, right? Because, you know, this, again, it's wage theft, so that's thousands of dollars that aren't going in people's pockets. And also people are working dangerously and putting other people at risk too if they're physically sick, right? Or if it's for mental health day, they're putting everyone in their family at risk too, right? To have longer term consequences down the line, not just the day that they're not taking off, right? So it's kind of important to remember that, not just the, you know, the upstream, but also the downstream consequences of not doing this, right? And we always say that community health, right? Worker health is a community health issue, and that everyone is also impacted, right, by not being able to take this time off the way that most people might expect as a general benefit, because employers that do the right thing are already giving out that time.
Thank you so much, Lou. Yeah, this is very concerning. We have to keep working hard to make sure everybody have access. And now I want to pass to Kinsel from SPAM. She is for the Parent Advocacy Network. And if you can share, Peg, more about, you know, what your organization does and what Pacey Days means for your community, the people that you represent in your organizations, and the various that people face in terms of access.
Thanks. I'm very happy to be here and happy to share that. I appreciate the kind introduction, Rosanna. My name's Peg Kinsel. I work for SPAN Parent Advocacy Network, and our mission is to empower and support families and inform and involve the professionals that are interested in their healthy development and education. Of course, our greatest commitment is to children and youth and families that have the greatest need. In that vein, earned sick leave was very important to us for quite a few reasons. Certainly our families, if any of you have ever gotten that call to come pick your child up because they have a fever and wonder how you're going to take care of that child tomorrow when they can't go to school and you have to go to work, earned sick leave was a huge benefit. For those of you that have ever wanted to go to a parent-teacher conference that a lot of times are scheduled, if you work in the day in the daytime, if you work in the evening time, and haven't been able to go to a conference with your teacher or the school to find out how your child's doing. That is another reason why earned sick leave is really important, because you could take it for any of those reasons. And we deal with as a Parent Training Information Center in New Jersey, we do a lot of technical assistance for families that have students with disabilities or special health care needs. And this earned sick leave bill became so important to us and to our families, because if you've ever tried to go to IEP, which is an individualized education plan meeting, or an individualized health plan meeting, or a 504 meeting, anything where you had to be able to be definitely present, be able to talk about the issues that your child were facing and find ways to support them in school, earned sick leave finally gave families an opportunity to attend those very important meetings. I heard a lot of, oh, well, you can do telephone conferences or you can do virtual meetings. And while that's true for some families, although not necessarily as effective, it's not true for a lot of families. If you ever tried to have a virtual meeting when you're working in a supermarket at a cash register, you could see why that would not work. I had very recently had a restaurant worker who her boss was willing to not necessarily give her this earned sick leave that she certainly could have taken, but she didn't want to miss the full day at work. And he vacated his office in the back to let her have that for an hour and conduct that meeting. But I don't have to tell most of you that is not typically what happens. So for our purposes, whether it's caring for a sick child, whether it's going to a doctor's appointment, whether it's attending these very important meetings and being recognized as the expert on your own child, earned sick leave is critically important for us in the constituency that we work for. If you want to, I don't know if you want to follow up at this point. Let me just say also that SPAN is a proud member of the collaborative, and one of our issues and why we work so hard on the collaborative was because this is a fantastic benefit for families, but only if they know about it. And that's been kind of the rub over the last few years, is making sure the community becomes more aware of it and then working to make that happen. So we're excited about the work of the collaborative. We're also working with some of the other groups on making sure that outreach gets out there. And I would call on every single person on this call to make sure you share the information you're learning today. Thanks.
Thank you so much, Peg. And I believe that Rosanna lost connection, so I'm gonna continue on. We'll come back and ask.
I'm back.
Oh, hey.
Yeah, I'm sorry. Thank you.
Yeah, no problem. Yeah, we were just, Peg just finished.
Great. Thank you, Peg. Thank you so much for all the work that SPAN do. I just have a couple of questions. Well, two questions. This one is specific for them. If you can share with the audience, like in your research, what are the, give me one second, like, if you can share, like, what are the violations that you found in the different workforce during your research, and like what are the possible solutions to really enforce the law and make sure like employers compile with the law?
Yeah, sure. Thanks, Rosanna. Yeah, I mean, so the main thing I do study is wage theft, and I've been working with my colleagues at Rutgers to help improve enforcement and work with state and local agencies to help them develop new strategies. And one of the big problems we face, and folks in New Jersey know this, is that most agencies use a complaint-based system of enforcement, meaning that the state only follows up on violations if they receive a complaint from a worker. And usually they go in order, right, from the complaints they receive. But the complaints they get are not necessarily reflective of the underlying rates of violations, right? So for example, almost everywhere, state and local agencies get more complaints from white men and from workers in industries like construction, right? And they don't typically hear from as much from non-citizens, women, people of color working in industries like private households and personal and laundry services, right? So what we've been doing for states and counties and cities around the country is comparing the rate of complaints that agencies receive by industry to our CPS estimates of underlying rates of violation. So let me just share my screen again real quick. If you can see that. So we conceptualize the relationship between compliance and complaints as this 2x2 matrix, right? And ideally, all the industries will be located in quadrants 1 and 4, right? Workers in industries with high violation rates should have, access to the complaint process, and they should be complaining at high rates. And where violations are low, complaint rates should be equally low, right? And so if that's how it works out, then the agency is allocating its resources really well. And we hope that no workers will be found in quadrant 2, right? High violation rates, but very few complaints are going to the agency. But we also hope that there are few in quadrant 3, high complaint rates despite low violations, because in either of those 2 quadrants, 2 or 3, it would indicate real problems in terms of enforcement resources reaching the right workplaces. So this is what I did another report for New Jersey on this, because New Jersey was interested in innovating and developing new methods of enforcement. And here's basically what I found. Several industries are problematic. So just to start in quadrant 3, that's where you get a lot of so-called false positives, meaning the rate of minimum wage complaints received by the New Jersey Department of Labor Wage and Hour Division significantly outstripped the estimated rate of violations in those industries. So a lot of people are complaining, but the violation rate is actually relatively low. And so resources were being sort of inefficiently allocated to those industries in quadrant 3. But the most troubling thing is those in quadrant 2, right? It's the industries that are found to have relatively high estimated rates of minimum wage violation, but workers in those industries make relatively few complaints to the New Jersey Department of Labor. So they include private households, accommodation, arts, entertainment, recreation. And so those industries, quadrant 3, quadrant 2, those are like dysfunctional industries, right? It's worth noting that the industries with the most false negatives in quadrant 2 tend to employ many women and immigrants, right? While the industries in quadrant 3 typically employ more men and historically have been more unionized, especially in New Jersey. So for example, we estimate that in the private households industry, which is much higher than any of the others, in New Jersey, that's 97% female, 51% non-citizen, 38% Latinx, and 0% unionized. The construction industry, by contrast, was 91% male, almost 70% white, and 26% unionized. So with this information, right, ideally, the state can start to develop strategic enforcement programs to target those industries in quadrant 2, right, with low visibility but high violation rates. And the department can start doing triage, right, on its complaints to prioritize the complaints they receive from underreported sectors. And then equally important, we think, is co-enforcement, which my co-author Janice Fine has written a lot about, whereby the enforcement agency partners with community-based organizations that have the trust of low-wage workers to help improve compliance, right? And in places where these partnerships have been established, it's reportedly been a generally good and constructive experience for the agency. There's variation, of course, but helps workers, helps the organizations in some cases. So strategic enforcement and co-enforcement backed up by hard data analysis, we think can be really helpful in improving enforcement capacity.
Thank you so much, Dan. And just checking time, we don't have a lot of time, but I want to give the opportunity, Lou, if you can, reply to that, what new labor think will be key to really enforce and have access to paid sick days.
Yeah, what Daniel says makes complete sense. I think a lot of organizations like ours align around that. Again, just going back to the idea that workers are the experts in their own realities, right? They know, like all these studies we do, where do you know what's happening? They just put numbers to them, right? So if workers are trained on what the rights are, what to be looking for in terms of violations, they can help co-enforce the law, right? So ideally, there's relationships where they're formally made, where, the state recognizes those groups to do it. But otherwise, we groups do it on our own, right? And there's ways already in the current system that we can be listed as third parties to complaints, for example, and have access to things. And again, as Dan just mentioning that, immigrant workers don't always want to come forward. So it's about building those trusts, and organizations like ours do that, right? So There's never going to be enough resources or manpower, from the state in any agency, just because, they're always underfunded, right? We need more, and the government doesn't always want to put those resources there, unfortunately. So it's incumbent to have, right, the eyes and ears on the ground that are experts to help do that, right? And again, the strategic enforcement also makes sense because of the limited resources to be focusing on the quadrants that Daniel was mentioning, right? Where we can start to make an impact where there hasn't been an impact yet, right? And then also forming it as a triage as opposed to doing it as the complaint comes in, because sometimes the complaints are lacking a lot of information. Going back to even construction, that and for us in temp agencies too, like, people don't always know where they're sent out to, right? They just know they're working at some location, right? And it's very hard to do formal complaints without having all the information, which is why you need to have groups on the ground that help gather that information to be able to do an effective complaint in the first place, right? So hopefully that answered the question. If not, do a follow.
Absolutely. Thank you so much. Yes, I just want to add on that, like, it seems like grassroots organization, other allies, we are doing a lot of work, doing outreach and educating workers and trying to reach out to them. But still we need there's another part, like, we need to really that can complement this work that we are doing on the ground. And like, I think that is key to succeed in, like, not just 49, like 2% of the workers or 49 know about the law, but 100% in the state have access and access to the benefit. I just want to add, Pat, on that, like, I know you mentioned that, but how your organization is investing, working to educate your members, your people, about the rights of paid sick days and the paid family leave.
Thanks, Rosanna. So a couple things right off the bat. The first thing we had to do was make sure that our staff was trained up and had a real good understanding of both paid family leave and earned sick leave, because we want to make sure that in every area we touch, that there's someone that can ask the question or give information or share a resource with folks that call or visit us at SPAN. So in increasing the awareness of those callers, we first just ask the question. And I think we have to be careful of language we use. We have to be careful of people's information that they're aware of. I spoke to a family recently and the mom said, "Oh, I don't get earned sick leave. I only get PTO. And the PTO, I have to ask for at least 48 hours in advance." So it was just total misunderstanding of what earned sick leave brought to them or could bring to them and what the PTO definition was. So sometimes it's just the language we use, and remembering that everybody isn't always cognizant of the language and information that we throw around. So we're working, we have ambassadors now at SPAN to help spread the good word. We're making sure that our trainings out in the community also mention the information, as well as doing some focus groups on families and why they don't know, why they haven't utilized it. Did it, was it just information that they didn't get or understand, or was there a compliance issue, as you guys referred to prior to this? So we have a lot of kind of touch points out there that we're working on strengthening, because once again, after the advocacy and the work on earned sick leave and paid family leave, it only becomes a trial if folks don't access or aren't aware of their ability to access this very important right.
Thank you, Pam. Thank you, everybody. I just want to thank you to Dan, Lou, Peg, for all the work and for bringing this information to everybody here. And now I'm gonna turn back to Nat. Thank you.
Thanks, Rosanna. And once again, I just wanted to thank all of our guest speakers for taking the time to share all of your perspectives, and especially